And everything that makes our area tick. Tonight, fear of going to the dentist can be so terrifying, some people avoid it at all costs. The director of the Dental Fears Research Clinic at the University of Washington says up to 8% of Americans don't go to the dentist because of this phobia, and that can lead to much bigger problems than a little cavity. For years, patients have prayed for a fear-free experience in the dental chair, and that could be coming to the Tennessee Valley. WAAY31's Travis Leader with TechAlabama.com is here with this technology breakthrough.
The days of drilling at the dentist's office could be behind us. A Massachusetts-based company has a product involving a laser, which could eliminate all those things you can't stand about the dentist's office. It sounds too good to be true, so I found a willing participant to test out this new technology.
I didn't even know when he started, so and it was done.
Wait, no numbing?
Our dentists generally report 95% or better anesthesia-free.
But North Alabama dentist Don Wilson, the only one in the area using the Solea 9300 laser, is even better than that.
If someone feels more than they want to, of course we'll always stop and numb it up if we need to, but that's really, really rare, 1%.
So how did a dentist like Wilson learn to use this technology?
I've always had a huge interest in lasers.
He's not kidding. Dr. Wilson loves talking lasers and his new toy.
They modify the normal CO2 laser wavelength, which is like 10,600 nanometers, down to 9,300 nanometers, which makes it work perfectly on teeth.
Now, what does that mean?
It just vaporizes tooth structure, so we don't have to use a drill, and we can remove the tooth structure, remove the decayed tooth structure, and do a cavity prep.
But here's the thing, what you see hitting the mouth right now, that green beam, isn't the laser doing the actual work.
That green beam is an aiming beam. It just tells us where we're going to fire. The 9300 nanometer, the CO2 laser beam, is way beyond our ability to see, so without that aiming beam, we wouldn't know where we were going to fire the laser.
Now, using the term firing a laser doesn't sound very settling. So I went right to the CEO of Convergent Dental, makers of this device. I asked the question you are probably asking. What happens if the laser hits skin?
If you run the laser over your tongue quickly or hit an adjacent tooth quickly, practically nothing happens. You do that with a drill, you can just imagine what it would feel like in your mouth.
The laser does have limitations, though, and this means Dr. Wilson still has to bust out the drill for a few procedures.
We still have to use a drill to just adjust the bite. We still have to use a drill to polish that restoration. We want it nice and shiny and slick and smooth.
And our patient Jonathan had the drill used on his touch-up as well. But as far as the laser portion of his routine filling?
It's the best experience I've ever had. I about fell asleep in the chair.
The Solea has received its FDA approval, and Dr. Wilson says there's no risk of the laser causing any cancers or posing any risk to those who are pregnant. For more on this and other tech business news, go to our website, TechAlabama.com.